All cancers start from normal tissue. And so what is important about pathology is a way to determine which tissue that cancer came from. So a pathology report is a report that's prepared by a pathologist that informs the patient and the healthcare team the characteristics of that particular tumor. And I think they should keep it in a file. It's a very important part of their medical record, and I would recommend that they have it. Pathology reports are very difficult to read, so if they had an interest in sitting down with a member of their healthcare team to go through line by line and be able to ask questions and to understand it, I think that would be the best approach. They can be several pages long, and they document basic patient information, the name, date of birth. They document what the specimen looks like visibly to the naked eye. They document what the specimen looks like under the microscope. And then it starts talking about other features, like grade, what kind of grade the cancer is. And grading is how much does this cancer look like the cell it came from. So if something is low grade or well differentiated, that means it's a breast cancer that actually really looks like breast tissue. So it hasn't become that abnormal, whereas a high grade or a poorly differentiated tumor is something that has become really abnormal. It barely even looks like the breast cancer cell that it came from. And those tend to be a little bit more aggressive. And then ultimately, there's a summary section. And in that summary section, it will start listing the stage that it is. So your physician, using the stage, the type of cancer it is, and then some of the other characteristics of the cancer, can determine the best treatment for you. They look at slides under a microscope. Everything starts with a mutation, and ultimately an accumulation of multiple mutations results in a cell transforming from normal to malignant. And a pathologist is somebody who can look at a cell and say, this looks abnormal. So a normal cell may look round and it has smooth borders and it has a very characteristic appearance. But an abnormal cell may actually have irregular borders. It may look more disorganized. It may not have boundaries like it should. So it's very obvious for someone who's trained in pathology to say this is abnormal. There are two types of pathology, are histopathology and cytopathology. Histopathology is a way of looking at tissue underneath a microscope, and cytopathology is a way of looking at individual cells under a microscope. And using one of those two methods and a lot of special stains, we can generally determine a very precise diagnosis. There are a number of other important characteristics of a cell. So pathology, I would think of it as, what does it look like at a molecular level, at the DNA level? What sort of change in the gene drove the formation of that cancer? Every single cancer is a result of some sort of genetic change. And that genetic change could be a DNA mutation, it could be a change in a chromosome that causes a DNA mutation. So for each individual cancer, there are certain mutations that we know of that are important. And sometimes there are treatments that can be directed specifically for that type of mutation. So in addition to our traditional way of looking at pathology, where we were limited to what we saw under the microscope, now we have a lot of genetic tests that can actually give us a lot of important additional information about the particular characteristics of that tumor and help us individualize treatment, which results in better outcomes.